What's up, guys? Look, I get asked this question a lot, and it was asked recently, how long should somebody stay on medication assistance? And it's a great question. And you've got different, viewpoints of this. Some people think, well, addiction is a disease, it's a lifelong illness, and you're going to be in recovery forever, so you should just stay on medication forever if the medication's helping you. And then you've got people who think, no, you only need the medication to be able to not have withdrawal, to stop whatever drugs you're taking, and then you taper off as quick as possible. You should be off of everything. And like most things in life, the answer is kind of somewhere in between, because the answer depends on the patient. It depends on the specifics of everyone's life and where the patient's at the time, right? Because some patients, you might formulate a plan, and what I like to do is think long-term and short-term. I mean, the initial thing is I've got to make sure somebody is safe. I don't want people to overdose. I don't want them dead. I don't want, that immediate concern. And then we need to look at the recovery process over the next several months, right? Because this is, those first few months can be very vital to how well someone's going to succeed long-term. And then we also need to look at the long-term plan. But that long-term plan is going to constantly change based on what's going on today, right? Because I might see somebody back in a couple weeks, and then maybe a couple months or whatever, wherever we're at in their process, and something may have completely changed. Maybe they've had a death in the family. Maybe there's just a change in jobs. Maybe any kind of situation you could think of. Maybe they have some kind of new illness. Maybe this changes their metabolism. There's lots of things going on with people at any given time. So the long-term plan has to be able to fluctuate if needed, okay? And that should never be thought of as a setback, because that's not a setback, man. Okay, if you're taking medications appropriately, as prescribed, for the reason they're prescribed, and they help you, you're doing what you're supposed to do, okay? So you should not feel guilty for taking medications. You are not substituting one drug for another, okay? It is not the same thing. I've got a patient, and, she is doing really well. I mean, she has been clean for years. She's not shooting up anymore. She is raising a special needs child. She's working, and she still struggles because, deep down, she has these strong cravings, just to go and get high again. But she fights it, and she's fought it well, and she's done great. But that's probably going to be somebody we're going to keep on medication assistance for a while, right? And because she was talking about how when she went to the emergency room for a problem she was having, she knew that they would give her pain meds at that point if she asked for them. And it was almost like a little mini struggle for her, because she had that, that demon in the back of her skull saying, yeah. But she was able, to stay strong and to push through. And she's happy that she made the right decision, right? But there are going to be circumstances where some people are going to need medication assistance for an extended period of time, and we don't know what the timeline is, okay? And as her doctor, I'm just going to work with her with a long-term plan, with whatever we decide that is, and every month we might just rehash that plan or decide, well, that's not the best long-term plan right now, okay? And that's how we adjust things in the short term in preparation for the long term, okay? So there's no timeline on your treatment, because yes, if you struggle with addiction, then you're in recovery forever, right? Even if you're off medications, even if you no longer go to meetings or have counseling, because maybe you've been 20 years sober and that's just not you anymore, right? But you still are in recovery. It's like having cancer that's in remission, you know what I mean? So you should always kind of have a plan, no matter where you're at in your recovery. But the thing I hate to see is when people start feeling guilty when they're actually doing well, you know? Feel guilty because they're getting help. No, don't do it, man. Don't do it, okay? You know, the way you talk to yourself and the way you treat yourself matters. And you need to treat yourself like you would treat somebody else. And you need to give yourself the same advice that you would give somebody else. I had another patient who was talking to me the other day, and he was like feeling really bad because he was not physically able to do the things he used to do because he had some very traumatic events in his life. And he was really hard on himself. And so I just asked him if, you know, an 80-year-old man who had retired from the military, served overseas, fought in wars, whatever, if that old man was, feeling guilty and beating himself up because he didn't have the physical capacity he did when he was 30, what would you tell him? You know, would you criticize him as well? No, you wouldn't do it. So don't criticize yourself, okay? Don't criticize yourself for things that are outside of your control, but hold yourself accountable for the things that are. This is essential, okay? That is the key. That is the key, okay? All right, guys, God bless. Peace.